Thank you, Diane. Just before I start, I did want to congratulate the Central Government of New Zealand for achieving affiliate membership. That's a big achievement and really sets you in a fantastic place to carry on and really strengthen this work. I also wanted to thank the Office for Seniors for bringing me to New Zealand. This is my first trip and I'm really thrilled to be, I guess, presenting on something I feel so engaged and so passionate about. So that's quite special to me. So this morning I'm going to race through a lot of information to share with you. I'll be starting just with a very brief overview of the global network, talking a little bit about the state in Western Australia and the partnership that it's had with the local government sector, then drilling down, if you like, to local government where I work, and giving you, I guess, some idea of the practical sense of how this works in communities, and also sharing with you a couple of quite cool projects that come from elsewhere in the world that I'm quite taken with and thought would be good to share. I've also got 3 little short video clips which I'll show throughout the presentation, which hopefully you find entertaining and quite useful as well. So the definition that the WHO uses is around, I guess, an age-friendly community has a whole lot in place that supports older people to age well and to age actively. So throughout my presentation, you'll be able to see this, I guess, context of everything I talk about is about supporting age-friendly in communities, whether it's a strategic policy or whether it's a project on the ground. You heard this morning, and I didn't realise that New Zealand was number 600, which is pretty good in terms of countries, states and communities that have made, I guess, the next step in joining the Age-Friendly Communities Global Network. I have to add, like Diane added, not everyone chooses to take that step. In Western Australia, we have 75 local governments who are using the approach. I think there's 4 or 5 of us who've gone on to become members of the global network. So it's not a requirement, it's just a decision for an individual council or community to make. The affiliated country programs are very significant, and that's obviously the category that you've joined within. The one in the US, just as an example, is the American Association of Retired People, and that has a membership of over 36 million. And that's really taken the lead in coordinating and facilitating age-friendly communities across the US. I should have added at the beginning too, I'm really interested in learning from you and understanding where the work is up to, the challenges, what's going well, because part of this way of working, and you'll get this sense as I talk on, it's very global and it allows us to speak a common language, if you like, in terms of being able to respond to ageing communities. So a little bit about WA, Western Australia. We're a very big place. In a way, there's probably a little similarity with New Zealand in that geographically we're isolated on our own continent. And I know that New Zealand has particular challenges geographically being located where you are in terms of isolation that you may feel. We have a sparse population. Most of us live in the Perth metropolitan area. We do have an significant ageing population, just under 20%, and that actually varies across different local government areas. And you can see that most of those live in the Perth area, but some live in the regions as well. So a little bit of a potted history. We were very, I guess, fortunate in that in 2006-07, the city of Melville, where I work, became aware of an opportunity to be a pilot city to test a very new methodology around age-friendly cities, as it was called then. And we looked for a partner. We probably didn't realise the strategic significance of our choice, which was fantastic, to actually go and approach our state government, who provided the research expertise through a department similar to the Office for Seniors here. So since that time, we've had this really good relationship that has continued to grow and continued to strengthen. The state government made available in 2008 a funding program that runs to now, and that's initially about giving local government amounts of money. It's not a lot of money. In fact, you'll see on the next slide the amount, but it's around 10,000 Australian per local government or per alliances of local government, because we have some very small rural shires of several hundred people. So they've been able to do some of this work by coming together and doing it in a collaborative way. That money is really for the engagement with our communities, it's for the initial research, It's for building our plans. It's only been recently that they've introduced a second sort of funding program, which is really targeted on projects that have to be linked to your plan. So they're looking for evidence around the project type and where it's come from. Interestingly, the local government sector, had a big input into the framing of that grants program, and we actually said to them, which is quite challenging at times, don't just fund one local government, make it that we have to have partnerships. So to get that money, we have to demonstrate we've got a partnership with another local government or a not-for-profit or a community group, and that really helps with the sustainability, because I think when you give money to one and the project starts, it finishes, it might have felt good during the time, but there's no sustainability opportunities to keep that going. You can see too that the state became, as Diane said, an affiliate member last year, which we're really pleased about, and they've also built it into their strategic ageing framework. So we've been fortunate at a very strategic level, they've had that framework, and local government can work collaboratively with them. So it's not a lot of money. In fact, it's almost like, you know, the low-cost version, which has worked. So over 10 years, the WA government has given us around 680,000 Australian dollars, which isn't a lot. That's supported 75 local governments to do that initial engagement, consultation and building of plans. That means that over half of our local governments are using that approach, which is pretty significant. And it also means that over 75% of people, older people, live in a local government area that's using that approach. We've also been able to, I guess, embed the age-friendly planning principles into our legislative requirement around community planning in WA. So it's very much part of a requirement around integrated planning and reporting. So it's covered in there. There's been some really fantastic work, and I'll talk about this, incorporating dementia-friendly with age-friendly, which we've done in the state, and a growing, I guess, interest and commitment around elder abuse and alliances, again, with that umbrella of age-friendly. There's also been a cross-government group, which I think, as far as I know, is probably a first in Australia. We had 16 local or state government departments like Housing, Health, Aboriginal Affairs, Office of Multicultural Interests, Public Transport and the like, come together to, in the first instance, really try and understand what this was about and their connection to it. And that did take some time. That group now is in abeyance because we've had a change of government, but it looks like it'll be reinstated, and we understand the Minister is actually interested in raising the profile of that group. We spent most of our time over the last couple of years having a role in working with the review of the state housing strategy, particularly with the emphasis for older people. We do in WA pretty much adhere to the domains, which is basically the methodology that gets used in this approach, because it has been tested in that pilot work, and throughout the world we've got those 600 odd cities and communities using this way of working. I like to say that it's pretty much, and this is a very potted down version if you haven't used it, but it's really about having that conversation with our older people, their carers, service providers, around what's working well under each of those and what's not working well, where are the challenges, and also offering suggestions for improvement, which can be really valuable. The state government, I guess, recognised along the journey that the real significance of ageism or age oppression, and I know there's been some great work done here as well in that arena, and so they noticed that this was a critical piece, that how can we address ageism in a way that will get people thinking around stereotypes and challenging attitudes. So they did a fantastic program, which is in its second year this year, which is actually using short films as a medium to challenge ageism or promote positive ageing. You can make the film on a mobile phone, or you can be a bit more professional. This is another really low-cost intervention. The total budget's around 20,000 Australian. That's the prize money, and also in terms of supporting the partnerships that they have with the film. So I thought I'd just share with you one of those films, which is a really little snippet. This is one of the award-winning ones from last year, and it's only about 2 minutes, so not very long. Yeah, Yeah, so hopefully that just gave you a little snippet of, they had, I've forgotten the total number of films last year, but it was a great success, and it ranged from little snippets, I think that you can only do 3 minutes, but from people who'd just made them themselves on their mobile phones, and lots of them were intergenerational, which this one actually was as well in the making of it, which is great. So just a very clever way of being able to challenge ageism in quite a creative manner. The other really critical thing for us in WA has been having a network of like-minded people doing this work that comes together on a regular basis. So since 2007-8, we've probably been meeting informally, coming together as local government, and then in 2015 we had a small amount of money through the Office for Seniors equivalent to establish a network, and we chose to come under the auspice of the local government professionals, which is very similar to your local government society. There's a number of networks, so we thought we'd asked them to auspice us, which they do. And basically we have a number of forums throughout the year. These are the sorts of topics that get covered. Again, this has come from the sector saying, you know, we want to understand more about the methodology. We want to understand how can we integrate dementia friendly. We have regional forums, which have meant travelling into sometimes quite remote parts in Western Australia for quite tiny communities that want to host something and bring together their surrounding shires to understand more about this approach. This is a really critical piece, because unless you've got that opportunity to come together and share how you're going and understand your strengths and understand the opportunities for collaboration and challenges, I don't quite know how you'd do it. It's a very important part. So I'll just drill down now a little bit into Melville, where I come from. It's a medium-sized local government in Perth of about 106,000 people, and we have a significant aged population. So even 10 years ago, it was probably around 18%. Now it's just up to 25%. So that's our community. So we had to do this work. We had to really understand what's going to make a difference for our older people. We do have some key, I guess, groups from other communities that don't have English as a first language, which I've listed there. And we also have a small group of Aboriginal people that live in our city. Again, we follow the domain. So basically it's using this methodology in its simplest form is what's going well, what's not going well, and do you have ideas to help us in terms of making it go better. We've done we're up to our 4th iteration because we've been on the journey a while. So in the last review, we involved over 2,000 people in our engagement process, which was the most we'd done. We did that in a whole range of ways. Surveys, which were hard copy, online, pop-up engagement, where we go to different places and our staff are there to talk to people. We used a community reference group, and that's a snapshot of them there. And their role was really to come together and give us guidance and advice around the engagement process, and then about the analysis of priorities. And then they disband. And we find that works best for us. I think all communities are different, but we like this way of, I guess, inviting lots of different thinking at a particular point in time. Those people then go on to become quite good champions. We also use input from other things that we're doing in local government, like our review of our strategic community plan, which is also about a lot of engagement. And we also used our local housing strategy, particularly with a focus on older people, as an input. So just as an example, and there'll be many of you in the room that have, would be familiar to this in terms of your priorities. These are the priorities for our city, and they've pretty much stayed the same since 2007. Some have different issues that have emerged under them, but basically they're pretty much the same. Some of the challenges that relate to those, and I think some of these are quite applicable in even, like in New Zealand. We have a big issue about how to reach socially isolated people, which I heard a little bit about this morning too. We also hear repeatedly people wanting information. I want information about health, I want information about how do I navigate this complex aged care system, lots of information, and we get into that space. We also have a very high number of people living with dementia, second highest diagnosis in the state, and really that's because of our ageing population, I suspect in part. And the other really interesting thing that we heard right from the beginning was feedback from people about their retail shopping business experience. We weren't really asking that, but people started to tell us, which was fascinating, and we've acted on that, and I'll talk a little bit about what we do. So in terms of the socially isolated challenge, we've now got a project underway called Heart to Hand. That's with 2 other local governments and 2 not-for-profits, really looking at how can we target and reach older socially isolated people. We have a very much a collaborative approach in Western Australia around our dementia friendly, so it's not an either or, it's a working together. And we've been fortunate that Alzheimer's WA, the peak body, have very much have that view and want to work with us. And in terms of the business, we've probably taken it one step further because we've been on the journey a while, and we've developed what we call a Melville Age Friendly Accessible Business Network, or MAFAB, which encourages businesses. It's not a formal network, it's more, I guess, giving an indication that you're willing to work to improve your business in terms of being more age friendly for your older customers. We've also, I guess, along the way learnt things, and one of them is around the branding and the promotion of what we do. We've recently reviewed our website, which is fantastic. So as you can see there, I'm just highlighting that because that's another critical bit. In the very early days, we did about 18 months of a lot of work. We pulled back 110 people who'd been involved in our really intensive research at that point and said, aren't we good? Look at what we've done. And they said, what have you done? And basically that was a very key lesson around branding and just continuing to use that language to explain the things that we're up to. We also have, like a lot of local governments, a big online digital presence, and part of that is around reaching older people. So it's branded, it's called Melville Talks, but we have a particular stream in terms of getting people to make comment and post things, news and that sort of thing. So in terms of the network, the business network, the other really interesting thing for us, and this is, I guess, about using your strengths. Our civic centre building is next door to one of the largest shopping centres in Western Australia. And we've had a very good relationship with them. And probably a few years ago, they started to say to us, we've got a real issue. Used to be lost children that we find every week in our shopping centre. Now it's lost adults. What do we do? How can we support our security staff when an older person comes in and is confused and disorientated about how they got there, where they've parked and the like? So we actually quickly got some training in through Alzheimer's WA to their security staff, their key customer service staff, and that was the beginning of an amazing journey with that shopping centre. And I think that if you are in a situation where you have a shopping centre, it's often an easier way than trying to tackle shop by shop by shop or business by business. It's more going through that centre management, understanding what sort of issues they're facing. So they actually brand themselves Age Friendly Garden City. That's the name of the shopping centre. Fantastic outcome. They've won some state awards. They're on a mission. They're redeveloping. They want to be the first age-friendly shopping centre in Australia, and they've done a lot of solid work around the design of that to ensure that the design is accessible and is particularly dementia-friendly. They have a range of things they do. Some of them are really simple, like having a service directory in big print. That's pretty easy. Having seniors benefits, which many businesses have. One of the most successful things, though, they've got is a mall walking group that's been going for 13 years now. So twice a week, early in the morning, around 140 people meet. They do big circuits of the shopping centre. They finish up together. They might have a coffee together. This is a really low-cost intervention that started with a little bit of grant funding from our city, from another group, and has just carried on because people, own it and people enjoy it. And the shopping centre loves it. So some of our current members are listed there. We've done training with the Apple Store in Garden City, with pharmacies, with jewellers, with stationery, with cafes, and really that staff working with Alzheimer's WA, going in particularly to give them information around dementia friendly. So as I said earlier, this has been a journey of not either or. And I know sometimes I hear that conversation in different places in Australia and also in the world. It's very much about integration. We've had some really good partnerships in many different local governments with Alzheimer's WA. The one that I'll make reference to here is we've also partnered with a small not-for-profit to bring a man, and if you Google him, you'll see what he does, Michael Verde from the US to Perth twice now. And he's a person who runs forums and workshops for people either experiencing dementia or their carers. Very powerful humanistic approach about really reaching for the person continuously in that process. The other really amazing thing that's happened along the way is that we had the first memory cafe, we call them, in Australia. And you may have them here, I'm not sure. There's now 11 in Perth. This is another really simple way of doing things. This is a cafe who said, we don't mind, once a month on a Tuesday morning, we'll make our cafe available to people with early dementia, their carers. A staff person goes, someone from Alzheimer's WA goes. It's very organic, so there's no structure to it. It's really just an opportunity to connect people. And what we hear from that is that often that's the very first place that people present after a diagnosis, because it's friendly, it's relaxed, it's safe. Having a cup of coffee and a piece of cake is a very natural part of life. And there's been some lovely stories that have grown from that haven't been our doing. It's been the people coming together and connecting with each other. So I wanted to share with you another short little film called Sonder. And this actually came about, it's made in-house by staff at my council, and we actually had it as an entry in that film festival last year. But it will really highlight for you, I guess, the friendships that have developed. And this is with some men that you'll hear from. Again, it's very short. I have to preface that you're going to see some amazing waterfront properties, and this isn't my city everywhere, because you'll see it and you'll think, my God. But no. Yeah, so that's I have to add that the couple there, Wendy and Keith, were really instrumental in getting that memory cafe going. They met my staff in one of their engagement sessions and really started to talk about what can we have, what sort of place can we have where we can connect with other people. So it's been incredibly valuable. And again, I add, it's not a big high cost intervention. It's really the generosity of the cafe, who does benefit, obviously, from selling things to the people that attend, and us promoting it and being able to send staff along. I said earlier, one of the other things that we're really involved with is information provision. So we do run around 6 to 7 information forums each year, and we generally have around about 120 people at each of those. They're pretty much booked out. And that's because that's something that our community have said they want information on. And these are just some of the topics over the last period of time that we've done. And again, it's around what are they telling us they want. It's not us deciding that we'll do this. It's what people are saying at these forums they'd like to get information on. The other interesting bit of work in local government has been around physical fitness. And all local governments, I'm sure, everywhere, have recreation services and leisure programs. And I suppose we saw this opportunity to, I guess, do more promotion with our older folk around remaining physically active. So we began to take exercise classes free to parks, and they're not just for older people, but for a whole range of different people. But the ones for seniors are incredibly popular in the warmer summer months in Perth and really well attended. The staff then had a really clever idea when they looked at their statistics around memberships to the facilities. So we have like a swimming pool and a gymnasium, and usually when people got to 65 or 70, they disappeared. And they thought, what can we do, what barrier can we reduce so that we can encourage people to keep being physically active? And in talking to the patrons, they realised that cost was a major thing. So they introduced this sliding scale, and you may not be able to see it up there properly, but basically from the age of 70, quite a significant discount kicks in. If you're coming to us at 90, you're getting a 90% reduction. And this is quite early days, because we want to see, does that make a big difference to people, that cost factor, and also coming out of peak hours. So again, this is the last little film I've got to show, but this is a lovely little piece they did really just around this campaign called Fit for Life, that again was made with lots of locals. So again, just a little example of, how you can have fun with it really. And the great thing for this, for me, was that I'm the Director of Community Development, a big directorate, and this was a service area that's saying, oh, you know, we're doing lots of things already for older people. You know, we want to do more. We want to really encourage older people to remain as fit and physically able as they can. This is another project which I just thought I'd share that I guess it speaks across a number of things. So in Australia we have reconciliation action plans which are encouraged for organisations to have with their Indigenous communities. And in ours, our elders, our Aboriginal elders said, we really want some sort of acknowledgement around the stolen generations. We want you to do some sort of art piece that's functional, that demonstrates and speaks to us and to the wider people about, I guess, the damage done in that period of time when children were forcibly taken. So this is quite new. This was only opened a few weeks ago. It's a seat carved out of a big piece of jarrah wood. We actually had a New Zealand carver, funnily enough, and an Aboriginal artist who collaborated on this. So this sort of ticks a number of boxes. You know, we're responding to things in our reconciliation action plan. This is age friendly because it's from a particular group of older people in our community. It's an art piece. It's there for the wider community to enjoy. So I just thought I'd show that because I think we can get a bit trapped in tunnel vision into what is age friendly. It's actually can, you know, be many, many different things. I'll just speak quickly too to the way that in local government we try and embed this in the way that we work. So it isn't just sitting separately to anything. In Western Australia, as I said earlier, we're required to have strategic community plans, and that's a process where, again, we're listening to our community and they're telling us what are your key aspirations. So you can see there the key aspirations are things like clean and green, healthy lifestyles, a sense of community, and you can't read this probably, but under a sense of community is directions for seniors, and that's our key informing document, which is our age-friendly work, that helps, I guess, inform us around what we deliver and what we do in that space to meet that community aspiration. So I guess I just use that as an example because you need to have systems and processes in place to be able to capture this, to make it work. We also do, I guess, a range of measurement, and we're not perfect in this space. I think it's, you know, worldwide that people grapple about how do we measure the return. But we do, I guess, ongoing evaluation. One of the things that staff very cleverly devised a few years ago was instead of waiting for the review period every 3 years or so, that every project, event, program we had, we'd have on hand a hard copy survey for people to complete. And that really tested back to those priorities. It collected some basic demographic information so that by the time we came to do the review, we might have had 1,000 of them. So it was gathered along the journey. We also do a community wellbeing survey, which asks some particular questions around older people, and that contributes to a scorecard. Probably I imagine in New Zealand you also do community perception surveys from your local government, and really I think most of them would have a question in there around age-friendly or services for seniors. So we were really thrilled when we did ours this year, and we hit the industry high in Western Australia for services and facilities and structures and things for older people. So this is a really key, I guess, benchmark for those of us in Western Australia that use this particular survey tool. I wanted to just share with you a couple of quite clever little projects that one of them comes from the city of Boroondara in Victoria, that's an age-friendly community and has been on the journey for quite a while. I think they're the only place I know of in Australia using this model called the Casserole Club that comes out of the UK. So again, if you Google it, you'll find that it's a UK product actually that you do pay a little bit for, And really that's about tapping into people in their own communities who don't mind cooking an extra portion of a meal that they might be cooking anyway, and then delivering that to an older person that they'd been matched to in their neighbourhood. And I know that's been very I guess, successful for that particular local government. The other place I'll just highlight for you very quickly is Taiwan. And I was very fortunate to visit Taiwan a couple of years ago. They have done really impressive age-friendly work. They don't have a very high ageing population now, but they've got a big bubble coming. So it has a lot of focus on health. And they have this really nifty travel card, which if an older person gets a vaccination, that gets listed, that gets recorded on that card. If they take their blood pressure, and they seem to have a lot of places where you can do that and just scan your card, that data gets recorded on the card. If you go to an exercise class that's run by the municipality, that gets recorded on your card. And then you accrue points. It's so clever. So you accrue points, which give you reduced travel costs and also lets you enter, I guess, museums and other things in Taipei City for free. Very clever little health intervention, which I was quite taken with. The other one from Taiwan too is that they have some very remote villages in mountainous areas. And so they were trying to figure out how can we stay in touch and keep an eye on and monitor the well-being of older people that live in those quite remote villages. This is actually a postal worker, and the postal worker goes into the village once a week with the post. So they upskilled postal workers who were interested in doing this to be able to take very basic assessments and be able to sit with the individual, take some information, then when they go back to the regional centre, hand that on. Again, I just thought it's a very clever little way of thinking of utilising something that's already there without introducing another whole cost structure. Interestingly, and I think in Australia, and you're probably the same here, they do things that we could never do. You know, they do things like they might take the rubbish out, change a light globe, do a little bit of tidying, which obviously we're so risk averse here. You probably couldn't get a postal worker to do that, but still, a good thing. And to wrap up, I wanted to, just highlight the amazing opportunity this gives to speak a global language. And when we first started on this journey in Melville, we thought, and we were part of that first cohort of 33 different places around the world, we thought, what on earth are we going to have in common with Tripoli in Lebanon? What are we going to have in common with people in New Delhi, in New York, in Shanghai, in Mexico City, in Copacabana? I thought, my God, we'll have nothing in common with these places. But really interestingly, and I'm just using the example of footpaths, is that what you call them here, footpaths or sidewalks? So in our city, older people said to us really early on, get rid of those, I mean we can't do this, but get rid of those street trees because they've planted this, it's not indigenous to Western Australia, and it sheds a gum nut. A nut falls all over the footpath, is a terrible tripping hazard. In Tripoli in Lebanon, it's olive trees. Same deal, big tripping hazard. In places in Asia, we heard that older people have a lot of trouble going around because of the people sitting on the footpath selling things or might be begging or homeless, that is a barrier to getting around. Unfortunately, in places like Istanbul, they heard that once you're pretty much older and a bit frail, you can't even go out because the footpath network is non-existent. In places like Canada, we heard how the earth, and I don't know if this happens here, freezes every year, cracking the concrete, which means for uneven footpaths, and again, a big challenge for infrastructure. Likewise in Japan, I think it was Akita in the north of Japan, they had big, and you might have this here, trouble with ice over footpaths, making big slippery barriers for people, and they've actually now embarked on a process where they heat the footpaths to melt the ice so that people can still get around. And I use that as an example because it's about, you may think that what you're doing here doesn't have that commonality or that thread across the globe, but it does. And it's just an amazing approach and methodology that I think brings people together, trying to make the world a better place for people who are ageing and who are older. So I really think you're in a fantastic opportunity here, place, because you have obviously big political buy-in to the process, which is critical, and the other end that's critical is the input from older people themselves. So it very much is bottom-up, but you do need that political top-down leadership as well to make it happen. So I wish you all the success, and this is a fantastic opportunity, I think, for you to come together and look at where there's places you can collaborate and work together. So thank you very much. And I'm very happy to have questions. I think we've got good 5 minutes. And I think there's a roving mic, so I think they'll bring that to you.
You're right.
Oh, have you?
The addresses of the skits on the, are they available at all? The movies?
Yes.
Can we get a copy of the addresses at all?
Yeah, you can certainly on the presentation, I've also included another page with a YouTube link. Yep.
Yeah, so all the presentations will be made available to you following the conference.
Can you just update me? It's Diane Brown from Age Concern Whakanoa. Can you just update me on your program for elder abuse and neglect services?
Yep, so elder abuse is really coordinated from the state level, and the alliance that's come together is the first time that that's happened. So they've brought together a number of, I guess, key agencies that are either for peak bodies for older people, or we do have a particular agency called Advocare in Western Australia that its sole purpose is around advocacy for older people. So we're looking at, I guess, that alliance strengthening communication and opportunities of what we can do together. They do have a helpline now, which was instigated by the government, that people can ring, and again that goes through to that Advocare organisation. I should add too, actually, that there's clear links, and I know there's been some research done about this, but the more you're age-friendly, I suppose there's a correlation between less elder abuse, because the more people are connected, the less opportunity there is for people to be isolated and vulnerable. So there is a body of work that I've read a little bit about where people are saying in age-friendly communities, because the focus is on trying to connect people, you're lessening that risk of people being very isolated and vulnerable.
Good morning. In regards to Western Australia funding, you mentioned 680,000 once. That's pretty low, isn't it?
Yeah, it is. Yep.
How do you manage? You have other funding that comes to you?
No. So we've done well on less. So the grant money has funded the engagement process. So the 10,000 that local government may get pays for the practicalities of involving a large number of people in understanding their needs. And then it's up to the local government to look at how can we, use what we've got, and how can we work smarter? How can we tackle this in a way that will be worthwhile and sustainable? So it doesn't really mean, huge projects. Some of these tiny places that are on this journey, may be doing quite minor things, but they're still doing them. Actually, I was telling them a story yesterday to the staff here about a butcher in this very tiny place called Walcatcham, which is in the wheat belt, probably less than, it's only got a few hundred people. The butcher's shut, has a high older population, and the town, this is an age-friendly example, but you don't have to have it written on a plan, I suppose. The town came together and said, we really need the butcher. So somehow they've contracted a butcher that comes in once a week, cuts up all the meat, and then the town volunteers in the shop. So they open the shop for 3 or 4 hours every day, and that's a lot of older people doing that work, to keep it open. So we'd say that's age-friendly, and they would say that too, but it's not something that cost a lot.
Kia ora. My name's Catherine Hall and I'm the Chief Executive of Alzheimer's New Zealand. So thank you very much for that fascinating presentation. I really enjoyed it. I particularly wanted to thank you for showing how dementia-friendly activities can be integrated into age-friendly, because that's something that's that we've been working on here. And so I also wanted to take the opportunity to acknowledge Diane, who I've been talking to about exactly that. So thank you.
Thank you. I have to say that if you've got people in your community, and you all would have, I'd say, that have dementia, you have to be doing the work, because that's who your people are. And I suppose we feel quite strongly about that, and because we do have large numbers as well, but that we really want to be working in partnership to deliver, you know, a much better outcome for those people and their experience and for their carers. So it makes sense, if that's who your community is, that of course, you know, you'd have to be doing it.
Kia ora, Christine. Thank you very much for that presentation, which was very inspiring and motivational. Here in New Zealand, we have an organisation called Grey Power, which is, it's not a service provider, it's an advocacy group that advocates local, central government and DHBs on behalf of the wellbeing of older people. Do you have such a group in Australia, and how do you work with them, if you have one?
So we've got two groups. We've got Council on the Ageing Australia, which is called COTA. So in Western Australia, COTA WA would come together at forums like this with local government. They'd always have representation at our network forums. They're part of the Elder Abuse Alliance. So their voice is heard there. And then we have National Seniors, which is probably a larger organisation with a more political focus. And there's a growing awareness there. I wouldn't say they're right across it, but certainly we've spoken at events that they've held so that they get an understanding of the process and what's happening at local government.
Kia ora. Good morning, and thank you, Christine. Like the others, I just want to say thank you very much for a really interesting presentation. I'm Kate Bundle, Chief Executive of Grandparents Raising Grandchildren Trust New Zealand. And what I'm really interested to know from you is about the extent to which your community of Melville City has similar issues to us. For example, in New Zealand, our membership runs to 7,500 caregivers. We know that from the last census there was over 9,500 grandparents in the parental role. And more than 3/4 of ours are raising their grandchildren because of the parental drug abuse, and of them 86% due to methamphetamine, which is pretty challenging for them. And I'm interested to know to what extent your community has similar issues, and how do you actually coordinate services that actually take into account the really complex issues that these caregivers have. Some of them are raising very young babies, struggling with their own health issues, and huge interfamilial issues as well, conflicts at times.
I know there's a similar organisation in Perth whose name escapes me, but it certainly has a similar aim around supporting grandparents who are caring. I think the other way to answer your question is that in local government, and I presume it's probably similar here, there's a good community development focus. So if you're doing that community development work, you become aware. And you become aware, and I know in our community, and I don't know if it's still running, but we'd come across grandparents who want some sort of level of support. So we might facilitate that, provide a venue, link them to the organisation, but our role wouldn't be, I guess, in there because we don't work a lot where I'm from with direct service delivery. We're more about that linkage and the community development work, if that sort of answers your question.
Okay, at this note, I know there's a lot more questions, but unfortunately we've run out of time. So I encourage you to catch up with Christine over the breaks or attend the workshop that she's running this afternoon. So on behalf of everyone, I'd just like you to show your thanks to Christine for the presentation that she's given us.